So the numbers, they're not good. Today, COVID cases are up across all 50 states. And stocks are down on Wall Street amid fears that a pandemic rebound could be slowing the American economy. So in a speech today, the president said our economic recovery hinges on getting the pandemic under control, also encouraging those holdouts to get vaccinated.
Virtually all hospitalizations and deaths are occurring among unvaccinated Americans. These tragedies are avoidable.
So with the highly contagious Delta variant driving the rise in cases, hospitalizations, and deaths, Los Angeles County once again requiring masks indoors. And the American Academy of Pediatrics, as we talked about earlier, recommends all students and staff nationwide wear masks in school, whether they are vaccinated or not. So our 9 Health expert, Dr. Paul Coley, is with us to talk more about that. Let's start with LA County, though. Everyone there now told or ordered to wear a mask indoors, whether they're vaccinated or not. Is that something that's coming our way? Is it going to other places in the country?
I think it is, Tom. I mean, look at the recipe that we're creating here. Cases are up. We have a more contagious variant. Testing is down. And the only counterbalancing measures that we had, which were the vaccinations, are dropping. And now we've gotten rid of masks and people are getting together. So it's sort of like stepping on your car's accelerator full force without having the brakes available to slow you down.
So if people are going to be asked or told to wear the mask, that's vaccinated or not, right?
That's right. And the idea there is twofold. One is that you're protecting yourself, even if you're vaccinated, from this more contagious variant because it's more contagious, so you could still get a breakthrough infection. And we know the vaccines are not as good. And the second is to promote this mask culture until more of us get vaccinated, because until we get vaccinated, that virus is going to keep spreading. And the partially vaccinated status that we're in right now is actually putting pressure on the virus to become to evolve so that it doesn't
become stronger, become more efficient.
Right.
So let's talk about masks then and schools. The American Academy of Pediatrics with that recommendation that students and staff at all schools, vaccinated or not, also wear masks. That's going to be something that people aren't going to like hearing. Is it something that they need to hear and adhere to?
It's interesting. I sort of mildly disagree with that, I think, because yes, masks work, and yes, our children are not yet eligible for the vaccine, so we should wear masks if they're not eligible. But I don't think this one-size-fits-all approach is what we should use. I think we need to tailor the approach. So we need to look at rates of vaccination and rates of infection in that community to decide whether this intervention is appropriate or not.
And that's going to be hard for people to follow or wish. I think a lot of people are skewing towards wishful science. They have science they prefer to hear or read that they gravitate towards, and that would include parents. Here's a stat that I think is so alarming. 99% of hospitalizations and deaths are occurring in people who are unvaccinated. So we have vaccines, masks, social distancing. Those are the 3 main weapons we've used. Is it really all about vaccination? Is that the whole point of, while the other stuff is important, the vaccine is it?
Tom, it's become a pandemic of the unvaccinated, just as Dr. Walensky says. The vaccine is the most important and impactful tool in our toolbox, but the other 2 tools are what we use until we can get enough people vaccinated.
Well, we'll keep an eye on that because it has been something to follow, to say the least, and to watch it continue to evolve just when things were seemingly heading in the right direction. We'll keep an eye on it. Dr. Paul Coley, thanks.